warm welcome to our audiences here today. Today we are graced with the presence of Associate Professor Dr. Dorothy DeWitt, who will be giving us an insight into virtual reality, and more so, virtual reality being used for creative digital education and training, and especially in the healthcare setting. So, Dr. Dorothy, thank you so much for being here with us today.
My pleasure.
Right. So I think before we begin, it's only fair that the audience knew a little bit more about Dr. Dorothy, our guest speaker here today. So let me just introduce them to you. So Dr. Dorothy is an associate professor in the Curriculum and Instructional Technology Department in University of Malaya, as well as a recipient of the Endeavour Executive Fellowship from Australia. So she's also been involved in research in collaborative and mobile learning, as well as designing instructional systems using cognitive tools as well as technologies for schools, higher education, as well as training. And she's been a consultant on several projects related to curriculum acceptance, digital learning, as well as being involved in training for technology, content, and knowledge. Adding to that, she has also won many awards in teaching innovations, both at the national and international level. And in fact, the team actually won the Best Immersive Learning Showcase in the ILRN 2020. And she was also awarded the University of Malaya Excellence Award for Innovative E-Learning in 2018. So I guess that means she's one of the best speakers here today to talk to us about virtual reality. So thanks for coming once again, Doctor.
Thank you very much for the beautiful introduction, Joel.
Yeah. All right, so I guess we can dive right into the topic, and we see the words virtual reality here being shown on the screen. So perhaps, Dr. Dorothy, you could give us an insight into what virtual reality actually is and maybe how does it work?
Okay, yes, thanks, Joel. Okay, so good day, everybody, okay, who's listening in. So if you don't know what virtual reality is, because you haven't been playing games online, all right, virtual reality provides you a kind of immersive experience. It's been used a lot in the entertainment industry. So those of you who have been using Xbox or perhaps even Oculus, Vive and all that would probably have had some kind of experience gaming in virtual reality. But for people who are more serious of my age, they normally don't venture into such things because maybe it gives them a headache and so on. But virtual reality provides you an immersive experience. You feel as if you are in the particular environment. So it has been used a lot in many cases. So if I were to share with you, there are places like museums and all that where you can experience virtual reality. Okay, but actually, okay, virtual reality is computer-generated graphics. Okay, if you can look at my second slide, I show a situation where you can use virtual reality. Okay, that's me actually in the picture there. Okay, using virtual reality, the HTC Vive. Okay, I'm going to show a video where you experience a 360 environment in a space walk. Okay, let's go into space.
PV2, we're 1 minute from egress. Time for last checks. Take a look at your gloves, Force. Make sure there are no tears.
In this video, you can really have the experience of being in virtual reality. So this is a 360 video of a person in space, okay, coming out from his spacecraft, okay, and doing a spacewalk. So you would see his hands, okay, as which are actually the controllers that he would have, and how he would move. Okay, so virtual reality enables you to interact in the environment. So I can put up my hand, grasp a particular object, open the door, the hatch, okay, and start my walk into space. So this is how it looks like if you're in that immersive environment. So virtual reality is actually all computer generated.
Take it nice and easy. We want to keep your heart rate steady. Anything
So I'll start my spacewalk, and you can have a look at this video, which is available online right now.
It's okay. My heart rate was going nuts the first time.
Have a look at how it looks like in space. So virtual reality is actually in a computer-generated setting, in an artificial setting. Sometimes it's in a video, and sometimes it is animated. Okay, if you look at the next slide, I think I share some of the devices, okay, that can be used for virtual reality. So you have seen the HTC Vive, which I used earlier on, okay, and here I show you the Oculus Go that I still have, but it's now considered obsolete, okay, and the Samsung Gear, which I also have. So these are some of the devices which can be used for virtual reality, and it has a hand controller for the Oculus Go, whereas the Samsung Gear, the controller is at the side of the device, where you have a touchpad to control and interact with the surrounding environment, and also the option to use a handheld controller. So these are some of the devices that you can use. If you go to the next slide, we can go at a more basic level. Google Cardboards. So at the most basic, it's just a cardboard with some lenses, with a pair of lenses, and you need your mobile device. Press next and you see how it looks like. So by putting in your mobile phone, most of our mobile phones are VR enabled. As long as the mobile phone has an accelerometer, a gyroscope inbuilt, okay, it can detect movements, and we can, by just moving our heads, tilting, looking from side to side, we can actually simulate and be in a VR environment. So I have done this with a lot of my students, okay, in education. We allow them to travel with virtual reality at the most basic level, just using their own mobile phones and a simple cardboard. Okay, so at the most basic, this is what you can use.
So thank you so much for showing us a bit on the virtual reality devices, and also seeing how it's a computer-generated setting. But I was just wondering, Doctor, how did this idea of virtual reality spark, and what brought about the advent of virtual reality goggles?
Okay, good question. So actually, we have been playing around with stereoscopic vision, you know, long ago. I did do a little bit of research in the history of virtual reality when I was on sabbatical several years ago. And in about 1849, a school teacher, Brewster, in the UK, had this device where he used two glasses, a pair of glasses, to look at things, you know, using stereoscopic vision. So I think that was the precursor of virtual reality, stereoscopic vision. And later on, a few other people like Heelig in 1960 started putting a more immersive environment using other visual. So the birth of the head-mounted device. And Sutherland, I think, did a lot of work, and he is considered the father of computer graphics. In 1965, his head-mounted device, okay, included 3D sound and even tactile feedback. So you could touch, okay, and it sends your hand movements. So that, I think, was the precursors. Okay, but in the next slide, you will actually see, so next, I have gone into the more modern. So the modern virtual reality headset and movements, hand movements, okay, kinesthetic movements, was actually started by Myron Kruger, sorry, okay, and he at that time didn't call it virtual reality, he called it artificial reality, okay, but this caught on, and Lanier okay, was the person who actually coined the term virtual reality, which remains until today, virtual reality. So historically, okay, it came about probably in the 19th century, okay, with stereoscopic vision. Yeah, Joe.
All right, thank you so much for that. That was very exciting, and to know that, you know, virtual reality has been experimented on like since quite a while back. Yeah, and to see how it's improved now, where, you know, you have all these cardboard and very minimal gear compared to last time, you know, which is quite funny to look at. Yeah, so that's nice. So Doctor, moving on in the setting of education now. So how do you see VR as Linear quoted being used in an education setting, and how would you say it differs from the traditional teaching classroom?
Okay, yeah, thanks, Joe. So if you look at the next slide, VR, I think, enables us to go to many different locations. So especially during the pandemic when we couldn't travel, right? Okay, we brought our students, I managed to bring my students to some places on virtual reality as well. So by going to museums, going to specific locations, we are able to engage with students, and this in turn also provides a very immersive experience. And yes, even if you want to go to places where we can't go, like outer space, or even within the body, or next to a war zone, a dangerous situation. So virtual reality actually enables us to travel to many different locations, even locations which are out of this world, okay, unimaginable. Next, I also see virtual reality being used in design. So in this particular photos that I'm showing is actually how Toyota used virtual reality to design their car seats so that it is both ergonomically suitable as well as safe in case of a car crash. So it's also used a lot to design and to solve problems. And next, I also see virtual reality being used in engineering. Okay, where we test out designs in automotive engineering. If you have the time, there's a video there on how automotive engineers design parts of the automobile, okay, using virtual reality. And also in universities, we are also giving problems to our students to solve. Okay, not yet in University Malaya, not so extensive yet in University Malaya, but they are solving problems using virtual reality. So next, you will also see that virtual reality is being used in medicine. Okay, how to imagine, what do you call that, Joel? The diagram that you see is a CT scan, isn't it?
Yeah, I think that looks a bit complex, Doctor. Yeah, I think it looks like a combination of both, I think. Yeah.
Oh, okay, you don't have to identify. We don't know what it is, right? And especially if you're a young first-year student, medical student, what's that? So virtual reality can bring something that is two-dimensional into three-dimensional. So it enables 3D visualization, and that has been done in many educational settings. So if you click next, you will see that that's not a heart actually, the CT scan, but surgeons and doctors can actually visualize how the particular CT scan of what organ it is in 3D. Okay, so it enables a three-dimensional visualization of the world in virtual reality. So I see it being used a lot in medicine as well. If I can go on, okay, in the next slide, I see that virtual reality is also being used for pain therapy, okay, especially like for children who perhaps patients, cancer patients and so on, they may be experiencing a lot of pain, but there's a lot of research that is going on where virtual reality helps in pain management and rehabilitation of stroke patients. Virtual reality seems to be very useful. I know that's not education, but that's in medicine. So just imagine the potential of virtual reality, if it's already being used in medicine, what more, can be done for training? So in training, virtual reality has been already used. So maybe this may spark some ideas among the budding doctors out there. In training, virtual reality has been used to document dangerous situations. So you see here, in a particular technician who needs to climb up a tall pole, he can't bring all his trainees with him. So he brings instead a 360 camera, which is mounted on his helmet. And when he's up there, the whole situation is videotaped or video recorded, okay? And he can even highlight certain dangerous situations, certain things that must be remembered by the trainees. So virtual reality has been used for training in dangerous situations. Also, if you see what is that, before that, the policeman. The policeman here has a special helmet which has also a camera attached to it. So that particular camera on the helmet takes videos of the surroundings, so that in case of in a crime scene, which is action-packed, okay, the policeman may not be able to see what's happening behind him, but the video captures it, and he's probably together. If you see like RoboCop and all that, you can imagine the situation where you have someone talking to you at the same time. Okay, watch out for somebody who's behind you, the suspect behind you. And so these are the things that are happening right now, and it can also be used for training. So in healthcare training, how will it be used then? So I'm imagining, okay, correct me if I'm wrong, that it can be used for things like learning anatomy. Okay, anatomy may be quite difficult. Maybe you may need to look at certain parts of the body more in detail, or have time to explore parts of the body and how they connect to each other, to one another. Simulation of surgical procedures instead of just using a mannequin. Okay, this is even more. Okay, you can explore, if the app allows you to, okay, even maybe do a surgery, do an operation, and see whether your patient survives or not. That's something a bit, ethically, there's no ethical issues, right? Because this is just an animation. So there's a lot of potential, I think, in healthcare education, okay, where you can explore using virtual reality. And if I can go on, so next, I have used a virtual reality headset, which was done by the University of Sydney when I went for my sabbatical, where they showed what a patient having cataracts would actually see, what a patient next having glaucoma would see. Where you see patches, probably there's glaucoma. Maybe I got it wrong. But it teaches empathy, so that the doctors, okay, would know exactly what your patients are feeling, are experiencing. And talking about experiences, I have that video there, which is a 360 video of how an autistic child experiences the world. So if you like to, we can have a look at that video now.
Just wait there 1 minute, I'm just going to get a ticket, okay? Alex, just 1 minute.
You know that an autistic child experiences the world in such a traumatic way.
Yeah, I never knew, doctor. It seems very disorienting, and I was a bit shocked to watch that video actually.
Everything's fine now. Yeah? Right.
experience in the world, and it's a frightening world actually, for them. So in healthcare, virtual reality can help us to visualize different situations. So let's go to a more happy situation. Happy situation, not so happy actually, because the next slide is on how COVID is managed, or how they train, simulations in training for how to manage COVID in an immersive video that I have here. So the next slide shows training slide, actually a training 360 video, okay, on how COVID is managed in a particular hospital.
Scenario here, we have someone who likely is going to need high flow oxygen in order to maintain his saturations, and likely will need to have a breathing tube. So we need to be diligent about our PPE and protect ourselves so we can be there for our patients.
Sounds good.
Okay, all right, let's go.
So this is a video that's been used for training at some of the hospitals in Philadelphia and New York.
My name is Julie. I'm going to be your nurse this morning. I'm going to get started by placing you on our cardiac monitor. How is your breathing without oxygen?
Not doing too well. It's still hard for me to breathe. It feels like.
In the second video, you can
One of the powers
have
of
the
this
experience
technology
of
is that we
being
can
in an
show you the
emergency room.
viewpoint of multiple members of the team. And so you're in an immersive environment, but we can put you in anesthesia perspective, in the scrub nurse perspective, and put you right in the middle of an emergency.
And I think that's quite exciting experience, especially for young doctors who may not be able to experience the real emergency situation, okay, but at least they have a chance to look at it on virtual reality, in virtual reality, okay? So next you will see that in the UK, virtual reality has already been used for training doctors, nurses, and so on. And they are using, in this particular picture you see here, this is from an article in 2016 actually, they use just a normal Google Cardboard headsets to train their staff. So there's a lot of potential, Joelle, in using in healthcare, virtual reality in healthcare training.
Thank you so much for sharing those beautiful examples of the, some of which are quite frightening, but I guess it lets the doctor properly understand what the patient is going through, and like what you said, you're able to empathize with the patient better. So yeah, actually we came across some of the photos that you showed also on the vision where you have glaucoma. I believe the last one is diabetic retinopathy. So
yes,
that's what people see when you have damaged the retina. Yeah. So, and I also agree on the anatomy aspect, because being medical students who are studying online, we don't actually have the opportunity to look at cadavers and all that. So, but thankfully there are a lot of apps out there, and I myself am using one. So it is really good because you get to visualize everything in a 3D way. And the app also actually has this thing called AR, or augmented reality. So you can sort of place the model like sort of in your living room or wherever you are, and then you can, so I guess that's really great. Yeah. So doctor, I think as much as VR has a lot of benefits, some may argue that, especially in the clinical setting, you cannot replace VR with the human touch, with actually seeing a real patient. So besides that, do you see any potential disadvantages perhaps of VR, especially in the clinical setting or otherwise?
I wouldn't say that, not being in the clinical setting is bad. It actually provides a little bit more training. So before you really go into the clinical setting, by going into the VR environment, you actually learn more and you practice more. So it's just except that clinical is virtually done right now. Getting more practice always helps, so that when you are in the real situation, you can perhaps even automatically know how to address the emergency. So I think that helps. Having enough practice virtually, okay, does give you a little bit of advantage as compared to a person who is not doing it virtually at all. And another thing I think is having the empathy and experiencing it as some kind of reality, the realism of being in that situation. So you are able to empathize better because you have that experience, you have more of the experience if you have done it virtually. So I think it is an advantage in some sense, but of course there are many disadvantages as well, because when you learn in virtual reality, you're actually learning alone. And if there is no interaction, it may be just you, and you form your own concepts which may or may not be correct. So as an educator, I would always say, come back to the real world. Go in virtual reality, experience it, learn as much as you can, come back and then discuss. What have you seen? What have you experienced? And this is the place where you address the misconceptions. So when you see things and sometimes you understand it differently, okay, having a place to collaborate and discuss. So in education, I always feel there needs to be a space where we come back and communicate with each other. So being alone in the virtual room, yes, that may actually not be the right way. You cannot just go on in virtual reality forever. So of course, there are many disadvantages. Money is one thing. Of course, the cost of the devices is a problem. And social norms, whether your head of department allows you to or encourages you to use virtual reality. If your boss doesn't encourage, then you may not be using virtual reality for training as well. Okay, so do they believe that virtual reality can help? So I think that there are many disadvantages as well, okay, which needs to be addressed. Yes, Joel.
All right. Thank you, Doctor. Yeah, I guess the analogy of virtual reality can be said as, like playing a video game where, you have to drive a car versus actually driving a car. So obviously it's different, but, it helps one way or the other. So, Doctor, I think you mentioned something about coming back to the real world. And so I'd just like to maybe listen to your insights on perhaps the psychological or social consequences of VR. Because I just had a discussion the other day, and one thing was mentioned where there are only two industries that uses the term user. So one would be the technology industry, and the other one would be the drugs industry. So where user is used. So yeah, I just wanted to know your opinions on the psychological aspect of it.
Okay, so I agree that there are many young people who are addicted to virtual reality games. Okay, but just imagine this, if they are addicted to learning and training in the healthcare industry, wouldn't that be fun? All the doctors will want to go online and maybe improve their experience. But I don't see this happening, actually. I don't think you as a doctor will be addicted to virtual reality. Okay, maybe gaming, yes. Okay, in your free time, perhaps you are doing some kind of gaming to relax. Okay, but I don't think that for training purposes that there will be an addiction. Okay, but being alone, yes, perhaps psychologically, I may want to do work on my own. I do not want to have others interrupt me. Perhaps that may be an issue. Okay, you tend to be more of a loner when you're using VR. So there needs to be alternatives. So if you are using VR for training, you need to put in that social aspect somehow. And I think with the metaverse now, Facebook has gone on to the metaverse. Okay, and there's a movie also about the metaverse, okay, where one of our actresses is in an international movie, a Malaysian actress. Do you know who she is? Okay, so she has many alternate realities available to her. So maybe that is a particular thing that would be coming forward. A metaverse for interactions and collaboration. Facebook has put forward the idea, and now we have to collaborate online. Okay, that is probably the next alternative reality.
All right, thank you so much for that, Doctor. And I think one more thing that you've mentioned is when talking about the disadvantages, you mentioned about the social norms, whether the higher ups would look at it as something beneficial. So as an educator or a tutor or teachers, so how do the teachers play a role in terms of VR when it becomes a tool of education?
Actually, this is still a very new and emerging field. In Malaysia, there are not many teachers who are using virtual reality at all, okay, and especially in the school setting. But we are trying to, for me exactly, okay, I do train pre-service teachers on how to use virtual reality to expose them to what is available for teaching in virtual reality. So we have to have a different mindset now. As teachers, you need to think about how you can use digital applications creatively. And gamification is one of the ways in which you can engage our students. Students nowadays, in the 21st century, you are the student of the 21st century. You need excitement because things are happening so fast. You have a lot of information on hand. Google is always there by your side. Okay, so you don't need more information. You need ways to manage and use the information. And that is how we can help students learn, by putting in elements of gamification, engagement, not just in acquiring information, but in giving them opportunities to use it to solve problems. I'm always thinking about solving problems, because I think when you solve problems, you have more experience virtually, okay? That would help you in the real world. So solving problems, testing out new situations and how you would respond in this situation can help education.
All right, thank you so much, Doctor. I agree with you on that as well. I'm of the idea that education and learning should be fun, thought-provoking, and not just taking in information and then regurgitating it out, because I don't think that way we were. Yeah. So, Doctor, in terms of maybe the practical costs of having virtual reality trainings and the maintenance of the things, how do you see the costs, like, and especially more so in the clinical setting?
Yes, unfortunately, cost is a very much big barrier. Okay, so if you have a look at the slides that I have shown here, to have a HTC Vive, which is considered tethered. Tethered means you have the wires attached to your HDMI, HD head-mounted device, and the handheld settings. You need to have a high-end computer. You need to have a gaming computer. The gaming computer itself will cost easily about 4,000 or 5,000. If you're using a PC, it's expensive, but maybe still affordable. If you're using a laptop, it will be more. It will be a higher-end laptop. Okay, and the HTC Vive, the devices itself, which you see on the right, will easily cost about the same amount, about 3,000. The more sensitive and accurate the device, the better. So it easily costs 6,000 to 7,000 to buy a real immersive headset. And with technology, you have the probability that it may go out of date. So probably you don't need to maintain it. You probably need to replace it from time to time. Okay, so if you look at the next slide, I show the Oculus Quest. Okay, the Oculus Quest, I have an Oculus Go, which is the earlier version. Okay, that's now considered obsolete. So I probably won't be able to get my device maintained if anything goes wrong. I'll probably just have to throw it away. So an Oculus Quest, which is good enough. I think if you have an Oculus Quest, which is a standalone headset, you don't need a computer, you're not tethered, you're not attached to any computer. It's a mini computer by itself. You can experience a lot of virtual reality environments. And with the controllers itself, okay, you can actually interact in the virtual world. Now, it's it's a Oculus Quest 2, which you see the white set on the right hand side. So that costs about 1,500 plus. Okay, without the apps. A lot of the apps are freely available on the Oculus Store, formerly Oculus Store. The next one, so if you're going to go for a more sustainable solution, would be to get a cardboard. Cardboards now cost about 5 ringgit, just a cardboard device. Okay, it used to cost about maybe 20 over ringgit for the cardboard. So with technology, the older devices, the older what shall I say, IPs, okay, it will cost cheaper with time. So you could get a device without a computer, without a mobile phone attached, like the one in the middle, virtual reality games, 3D glasses. So we call that a VR box. It's just a box with the lenses. The more expensive boxes have better quality lenses in general. So you can even have some Polaroid glasses and so on. So it will give quite a good experience, but you will need your own device. Okay, you need your own mobile phone to be put in. Otherwise, it can't function at all. Okay, but there's a lot of applications available which you can use on your mobile phone. So I hope this helps answer your question on the cost of the device.
Yes, it definitely, Doctor. And I hope, just like the cardboard going from 20 to 5 ringgit, I hope in the future as well, as technology progresses, then things will get a bit more cheaper.
Yeah, that's right. If I can share with you the apps, you can get the apps in the next slide on Google Play Store if you're using an Android phone. If you're using Apple, on the Apple Store, right? You call it, or the Apple Store.
Yeah, the App Store, I believe, yeah.
Okay, and if you're using Xbox, there are a lot of virtual reality applications on Xbox. And Oculus, it used to be Oculus, but now Oculus is changing to the metaverse because it has been acquired by Facebook. So you will see these symbols, and these are the places where you get the applications to view in virtual reality. Some you have to pay. Some, they have a limited version, a free version, okay, with option to upgrade to a paid version.
All right, thanks, Doctor. I'm looking forward to getting one of those myself as well.
I hope you enjoy it.
Yeah. So, Doctor, moving on, I think earlier you touched a bit on how the education system, especially in Malaysia, we've not come so far as to incorporating VR into education. So I'd just like to ask a follow-up question. So are there any major companies in Malaysia who have maybe started developing this technology, VR, or maybe incorporating them into their own companies, and what can we expect from them in the future?
Actually, at this moment, I don't know of any companies which are going all out in VR development. People are trying, just experimenting at the moment, and most of the VR development we see is on the 360 videos, just like the ER situation, the emergency room situation, a 360 video like that, because I guess that is the cheapest form of virtual reality. You just need to get the camera and edit the video after that. There is a lot of work required in using animation. So if you want an animated lab situation, that takes a lot of work and a lot of effort. I guess what is needed now is maybe developing such situations with lecturers in University Malaya. Okay, so probably the designers and developers on their own, they don't have the expertise. However, maybe what can be done is having collaborations. Okay, I see in other countries, like in Australia, in Switzerland, okay, the universities collaborate with the companies to produce virtual reality environments in the medical and healthcare profession. So what they have done is they have produced lots of apps, okay, not too many yet, but there are apps where budding surgeons could try and do an operation. So interaction. So what is missing right now is that interactive simulations, okay, because that is what we need more. If I do this, what happens? If I cut too deep, okay, what happens? How do I measure the strength of the cut? Okay, if you're talking about cut, surgery, incisions, and so on. So that is needed, and that is still lacking in Malaysia. Okay, so we probably need to have more collaborations with the industry.
And yeah, I think especially on the tactile aspect of it, the texture of actually, making the incisions of the skin, and then, drilling the bone as well. So I guess, yeah, it takes a lot of effort to, properly and accurately simulate those settings. And then obviously you have the other stuff like the background noises, the heart lung machine beeping, and then the knives clattering and all that. So yeah, but I think technology has improved so much over the years, and so I'm sure we can see like a proper, simulated setting, which is almost exact to the real one. Yeah.
Yes, I'm sure it's coming soon.
Yeah. So Doctor, just I guess the next question would be: do you foresee the replacement of traditional physical healthcare training with virtual reality?
I probably don't imagine that there will be a total replacement. No, that's impossible. Just like you have those mannequins where you practice how to do, let's say, CPR and so on, right? Those mannequins have been from the, just a dummy to some mannequins with some input and output. Okay, if you put too much pressure, right? Technology has gone into every aspect of our life, okay, but it has not replaced the doctors. That you can't replace people. Okay, so similarly with virtual reality, to me it will just be maybe a situation, a hybrid situation perhaps, where doctors train younger doctors, novice doctors, using virtual reality, trained in different situations. Just like surgery has also now gone into robotics and other things, that technology is coming into every aspect of our life, in training as well. And it's not going to replace, but it will become normal after some time. It's natural. You have to go through this first, then come and see me in my class or come and attend my sessions. Okay, I think that's going to be the way forward.
All right, thanks, Doctor. So I guess the slide is currently showing the way forward. So in line with that, I'd just like to know, what are your aspirations and goals of seeing VR in education and healthcare moving forward?
I think virtual reality has a lot of potential. So I am sure that we can train our doctors, our nurses, and people in the healthcare industry, not just the practitioners that I mentioned, okay, but even people who need to take care of elders, to take care of young children, okay. I think there's a lot of potential in getting them to empathize, getting them to learn how to react in different situations using virtual reality. But I think the last hurdle will be actually more of a mixed reality. So Joel, you said you have used augmented reality. So I think that is going to be the way forward. It is not just being in the virtual world, it's how we augment technology in our world. So augmented technology, which is the picture on the right, is how we will probably be doing our training in the future. So a mix of virtual, so it's a mixed reality. Okay, we have virtual reality on one end, augmented reality on the other end, and anything in between may work in the future.
All right, thank you so much, Doctor. So I guess that brings an end to our very insightful podcast session. So I guess before we end, since most of our audiences here would be millennials and budding doctors, so perhaps you can give us like some last words of advice, or any parting messages before we end.
I think the millennial doctors here are fantastic, okay? But don't forget, you are millennials now. Don't forget tomorrow. Always keep up to date with technology. Keep on improving your skills, okay? Because the doctor of today, okay, will be the trainer for tomorrow. So I wish all of you good luck, okay? And I'm looking forward to all the exciting technologies that you will be using and you will be producing. I'm sure some of you will go on to even produce and be not just the users, but the designers of how to use virtual reality and mixed realities in training, in healthcare training.
Thank you so much for that wholesome message, Doctor. Yeah. So I guess that marks the end to our podcast session. So once again, I'd like to thank Associate Prof. Dr. Dorothy DeWitt for sharing her insights with us on virtual reality in education and healthcare. Thank you, Doctor.
Thank you. Thank you. It was my pleasure. All the best to all of you.
Yeah. Thanks, Doctor.